Can you be revived after respiratory arrest from an opioid overdose? Have you ever wondered if someone can be revived after experiencing respiratory arrest due to an opioid overdose? This is a critical question, especially as opioid addiction continues to impact many lives. The good news is that revival is indeed possible, provided that immediate and appropriate actions are taken. When someone overdoses on opioids, the brain's respiratory centers are affected. This can lead to inadequate breathing or even complete cessation of breathing. If this situation is not addressed quickly, it can result in cardiac arrest. However, it is important to note that respiratory arrest usually occurs before cardiac arrest in these cases. This means that if breathing is restored promptly, it can prevent further complications like irreversible cardiac arrest and brain damage. One of the most effective ways to counteract an opioid overdose is through the use of naloxone. Naloxone is a medication that works rapidly to reverse the effects of opioids on the brain's respiratory centers. When administered quickly, naloxone can restore normal breathing and potentially save a life. In addition to naloxone, rescue breathing and proper airway management are essential. If a person is not breathing or their airway is blocked, providing rescue breaths or assisted ventilation can be life-saving. It is important to act quickly since brain injury can occur within minutes without oxygen. Interestingly, studies show that survival rates after cardiac arrest related to opioid overdose are often better than those caused by other factors. This is partly because many individuals who experience opioid overdoses are younger and generally healthier. The key to a successful revival lies in rapid response. The sooner someone recognizes the signs of an overdose, calls for emergency medical services, administers naloxone, and performs rescue breathing or cardiopulmonary resuscitation, the better the chances of a positive outcome. Some individuals who appear to be in cardiac arrest may actually be experiencing severe respiratory arrest with a weak pulse. This condition can be reversible with prompt intervention. From the perspective of substance abuse and addiction, understanding that opioid overdoses can be reversed with timely action highlights the importance of making naloxone widely available and ensuring that people are trained in how to respond to overdoses. It also emphasizes the need for education on recognizing overdose symptoms, including respiratory depression, and the critical role of rescue breathing alongside naloxone administration. In summary, revival after respiratory arrest from an opioid overdose is achievable if immediate steps are taken to restore breathing and reverse the effects of opioids. This highlights the life-saving potential of naloxone and emergency respiratory support in overdose situations.